Cases of whooping cough are now 3 times higher this year than the same time last year, and that's according to the CDC. So what does this mean for your family?
Here with some insight, Dr. Ali Raja, Deputy Chair of the Department of Emergency Medicine at MGH. Dr. Raja, good to see you.
You too, Ben.
All right, I know nothing about whooping cough, but I will tell you I'm a little surprised that the numbers would be so high, especially given that it's summertime. Are you surprised by these numbers?
I'm actually not, Ben. The fact is that you're right. The number of cases that we've seen so far this year is like 10,000 compared to 3,000 last year. But I'll tell you, last year's cases were actually still low due to the pandemic, social distancing and isolation and masking. So now that those barriers are gone, we're seeing the kinds of numbers we're seeing pre-pandemic, just like we did with RSV last year in the winter. So it's about what I would expect if the pandemic hadn't happened.
Makes sense. Parents are dealing with this infection for the first time. What do they need to know? I mean, should they wait to see their doctor? When is it a good time to see you or your colleagues at the ER?
You know what, Jessica, that's actually a great point. Because of the fact that the numbers have been low, and this usually affects kids between the ages of about 6 months to 6 years, there are parents who have never had a kid with whooping cough before. So first of all, most importantly, whooping cough has had a really effective vaccine since like the 1940s or 1950s. So, most people get their kids vaccinated, and everybody should. If you have any hesitancy about vaccines in general, just talk to your pediatricians and work through what those are. But in general, if most cases of whooping cough can be treated with antibacterial medications through pediatricians, but if your kid has real trouble breathing or starting to turn blue, come on in and bring them into the ER.
And so you get that vaccine, it's pertussis, correct, is the term for the vaccine?
Nailed it.
So if you get that as a child, does that mean you can't get whooping cough, or you just would have a more mild case?
You generally have a more mild case. When we compare the data from pre-vaccine, now we're talking like the 20s and 30s, to now, it's about a 90% drop in cases of whooping cough or pertussis, and the severity goes way down. And so in general, it's a really effective vaccine, but like we've seen with every vaccine, it's not perfect. So you might still get the illness, you're just going to be less sick than otherwise.
All right, Dr. Ali Raja at MGH, good information.
Good to see you, doctor. Thank you so much.
Thanks, Ben. Thanks.